Hi you guys, and welcome back to my channel. If you are new here, welcome. My name is Keita and I am a respiratory therapy crew. Hi you guys, and welcome back to my channel. If you are new here, welcome. My name is Keita and I am a CVCC graduate from Respiratory Therapy School. If you are interested in this video, just keep on watching. All right, you guys, if you are interested in this video, thank you for clicking on it. Make sure that you subscribe to my channel and hit that notification bell down below so that you will never miss any more of my content that I'm putting out for you guys. Like I said, I graduated from my respiratory therapy program from Central Virginia Community College, May the 12th, 2022. And I have a subscriber of mine, and I will post a picture of that as well. Her name is Claudia Bradley, and she has been with me for a while. She's been subscribed and joined to the family, and she requested this video. And I have just some notes right here just to keep me on track with what all she asked for and requested in this video, okay? So a little bit about her. She subscribed to me, like I said, a while ago, and she's been with me almost my entire journey throughout respiratory therapy school. And she requested this video looking back over my first and my second semester of respiratory therapy school and what I thought about my classes, as well as if I purchased any extra books or if I used any websites or videos to actually help me get through my actual respiratory therapy program. And just an overall look back over my first and second semester of RT school. And she also asked about my flashcards and how I set up my folders for clinical. All right, so boom. Thank you so much for requesting this video, and I do sincerely apologize about the lateness of this video, but we're gonna jump right into what you requested. Okay, so my first semester of respiratory therapy school, I did RTH 101, which was my integrated science for respiratory care class, as well as RTH 121, which was, I think it's cardiopulmonary science 1, as well as an RTH 190 class, which was my clinical class. All right, so we're gonna set this right here for the time being, and I'm going to show you guys what actually I did for my first and second semester. Well, actually throughout my program. Hopefully I don't drop any of this stuff because I got a lot of stuff to show you guys. This right here is my folder for my first semester of respiratory therapy school. Okay. This is how thick it is. On our first day of respiratory therapy school, we went to class and we went over our syllabus for each and every class, and we went over our clinical schedule. Your school may do that, but I'm not exactly sure. But from my program, we were required a certain amount of clinical hours. And this right here was our clinical schedule. And we had clinicals anywhere from a 4-hour shift to a 6-hour shift and an 8-hour shift. And we also had a night shift clinical. We had clinicals on either Tuesday or Thursday, and we had class Monday and Wednesday. Okay, so let's get right into this. I know this is a lot, you guys, and this was like a handout that our professor provided for us of which books and stuff that we were required to have for our program, and which was helpful. And as Miss Claudia asked me, all of my books were gifted to me by a lady that I work with at a level 1 trauma facility. She gifted me everything from all of my books to all of the collection for the Dana Oaks books. So she gifted me all of that. So Morgan, if you are watching this video, thank you so much, because you really blessed me. You gave me everything, all the tools and stuff that I needed. It was just up to me to dive into those things, okay? So she also, my professor also had us do the AARC website. So we had to log in, register, and all of that stuff, because we were required to do certain things on the AARC website. Since we are respiratory therapists, it was a no-brainer for us to go ahead and sign up and become a actual member. Within the AARC website, we were required to do CEs. No, yes, it is CRCEs. I hope I'm saying that right. And then we had to do CRCE through the journals as well as webcasts. And they are things that are on the actual AARC website that we were required to do for our program. And like the webcast, it was like say like they were doing neonates one day, or say like if they were doing a asthma education one day, we would go through and watch like the PowerPoint slides, and they would have like a guest speaker, and they would speak on that specific subject. And that, like 15 minutes or 30 minutes or whatever, they would have like a little check-in to make sure you was paying attention. Because if you don't check in and push that little button and click that little button, honey, you're not getting credit, and you will not receive your certificate at the end. So those certificates were required for my program, and they were very, very informative. Like, they gave you so much knowledge and information. Like, I always took notes on those things, because guess what? That's my field, and I'm going to see that again. You see what I'm saying? All right, so that was the only website outside of the NBRC, in which we'll get to that later, but we didn't do a lot on the NBRC website at semester 1, because that's like for practice tests and stuff like that, TMC tests and stuff like that. But we did actually use the NBRC as well. My first semester for, let me see, what class is this, because I'm trying to do this for y'all. I'm trying to find my syllabus because I had a lot of stuff going on. We did like a mechanical, no, not a mechanical. What am I talking about? We did a medical terminology class, and that was online through our Eva Lister. We did a couple of those, as well as the CERCs. And let me see. Let me get to my integrated class, y'all, because I got like to-do lists in here and everything. I'm going through my book right now. So this was our integrated science for respiratory care class. This was the meats and potatoes, the skin and bones, however you want to use it, however you want to say it. But this was our integrated science for respiratory care class, and this is one of my actual PowerPoints. And we learned like the history of respiratory care, like what Hippocrates did. Like, let me see. It's been so long since I've seen this stuff, y'all. Oh my God. What Joseph Priestley did when the first oxygen tents were used, like mechanical ventilation, airway management. Like, we learned a lot of stuff for the history of respiratory care, and this stuff goes with you throughout your career, okay? We learned evidence-based medicine. We learned what HIPAA is and what that stands for. And we learned like cleaning and sterilization and disinfection of our equipment. So we had all of those in our integrated class. So our next class was the RTH 121, and that was the cardiopulmonary science class. And this again, as well, is the meat and potatoes of our program. We learned the lung volumes and capacities. We learned the body surface area, minute ventilation, dead space, alveolar volume, ideal body weights, the alveolar air equation, We learned some metrics like centimeter, decimeter, meter, kilogram, all of that stuff. Um, we also learned the temperature conversions. We learned the property of liquids, the humidity, ventilation. We learned all the laws. And you guys, when I tell you all, I took detailed notes. I took detailed notes throughout my program because I made flashcards, and we'll get to that in a minute. Um, we learned the respiratory anatomy, its function, and its structures. Okay, so we learned like the anatomical directions, like anterior is your front, posterior is your back, stuff like that. Um, we learned chest x-rays. We learned the muscles of ventilation, accessory muscles. We learned the anatomy of the lungs. We learned all of that stuff. And we learned like each segment of the lung, like the apical posterior, the superior, the anatomical basals. I said anatomical. The anterior basals. And we were actually quizzed on this, so just to make sure we knew them. We learned a lot of stuff, y'all, in my first semester. And y'all, it was a lot of information to take in at one time. And I was like, oh my God, y'all, I'm not gonna make it. We learned the heart our first semester and how the blood flows through the heart. We learned stroke volume. We learned EKGs our first semester. We learned the limb leads, all of that stuff, y'all. We learned it all. The nitrogen washout, the body box, all of that stuff. We learned it all. In all of this, we learned our geriatrics. We learned congestive heart failure, all that heart block stuff, all of it. And then we had some laboratory data. So like we had to know like sodium, chloride, potassium. We had to know all the normal values of all of that stuff. And you guys, I'm just paraphrasing like the stuff that we actually went in depth of learning, because we learned a lot more than this. I'm just giving y'all like a skim breeze through of my notebook that I have here. We learned AC1, lactate, glucose, and we also learned chest radiographs. So as a respiratory therapist, you got a patient that come in and they order a chest x-ray. Your chest x-ray leads you in the direction of what is going on with your patient. You know what I'm saying? So if your patient comes in with a normal chest x-ray, you would know what a normal chest x-ray is. So if they have other things outside of a normal chest x-ray, like air bronchograms, a pneumothorax, you know what I'm saying, stuff like that, this you can visually see infiltrates, vascular congestion. Like, it is a lot of stuff to learn. You can see a right mainstem intubation. You can see if your patient intubated or not. You can see from the carina your right and left mainstem bronchi, like the Dana Oaks book, as well as these PowerPoints. That's where my flashcards came in. Okay, so where I did a lot of on the go moving around and stuff, I did a lot of flashcards. We're going to go to this right here. This was my flashcards that I made. These are just my respiratory therapy formulas and abbreviation, and these are things that like I seen that I knew that I was going to have to know like on a regular basis. Like if you keep going over the material over and over again, like it's going to become like muscle memory to you, and it's going to be like secondhand nature. Okay, so in here I always started out with a Bible verse in my flashcards because I am spiritual, but I don't want to like put off my religion on any of you all. But it really helped me get through this program, y'all, because sometimes, I'm not gonna lie to y'all, I done cried, been up all night trying to study for these tests and exams and these quizzes and stuff, because you could literally go over the information the day before you take a test on it. You know what I'm saying? Like if you go to class Monday, Tuesday, you got clinical. You got clinical for like 4 hours or whatever, and then you come back home and then you trying to study, and then 8 o'clock you got to be right back in class. You know what I'm saying? So just be mindful of that. I wrote my equations and stuff down. My stroke volume times the heart rate equals your cardiac output. And I wrote like detailed flashcards. So this was the back of that flashcard. Like I wrote detail, and I mean detail. I wrote out my lung volumes. This was going to be really, really important for you all. This you will need for PFT class as well. These lung volumes and capacities, they will creep up on you. So make sure that you know what they do, how they are, and what will go on with them. I wrote these out in very, very specific detail. Very, very, very specific detail. So all of those that you just previously saw was the vital capacities. There's another Bible verse. And I did that throughout all of my lung volumes and capacities. Because I knew that they was going to give me trouble, honey. And still do. But it's okay. It is okay. I'm trying to get this one open, y'all. And this one right here is your alveolar oxygen ratio. Let me see what else I think that you all are going to need to know. Getting into this pico, paco, pico. Know that. And your pack years and your ideal body weight. And you need to know this alveolar air equation. You need to know that. Let me see. I wrote down all of this stuff, y'all. So this is your ideal body weight. But once you get to catering, there will be a condensed way to learn this actual formula. But I did flashcards for all of my formulas and things like that. I did a lot of flashcards. So then we started learning a lot of bulk material. And this section right here, like I have like a little sticky right here. And we had some medical terminology that is helpful for us. See, A with a double line on it means before. So this was like our little medical terminology portion. And when you dive deeper into your program, you're going to get those too. And let me see. Got the conversion factors for your temperature. And these are just some of the things that I went through from my PowerPoints and transcribed to my flashcards. So that's how I did that. And then we got some total cycle time questions, because we learned this as well. You're going to need to know that, because our program tested us heavy on those. Because you got to be able to calculate that for the ventilator. You got to know their eye time and all of that stuff. Tidal volume, all of that. So that was my first semester. So looking back over my first semester, I felt like I was gonna die. Felt like I was not gonna make it, because it was so much information that was coming to me at once. So flashcards really helped me to get what was thrown at me. You know what I'm saying? Like, it was a lot of information that was given, and I had to absorb it and get it in my head. Um, it was a lot of sleepless nights because I was up crying sometime, like, oh my God, like I cannot do this. Like, this is a lot of information. And me and my classmates, we stayed on Zoom sessions. We was calling each other. We had a group chat. We was like, yo, we was asking us we was asking each other questions in regards to stuff that we was learning. It's like we was quizzing each other, like helping each other along our journey to get through this program. Um, we did a lot, and I mean a lot of flashcards. Like, um, for the stuff that I learned, like I'm a visual learner, so myself, this postural drainage here was an actual check off, and we actually had a PowerPoint on this. So postural drainage is, say like if somebody have fluid or whatever in their lung, you would place them in certain positions to actually drain it, to help them be able to breathe better. You see what I'm saying? Like, it is so many different ways that you can place your patient in to help them breathe better, just depending on what lobe you are doing. This right here gave me a run for all of my money. Do you hear me? Like, you have to know which way to lay your patient to drain or percuss your patient. Like, I cried a lot with this right here. And we was tested on it mad heavy. Mad heavy. We was tested on this. Like, all of this stuff. We had to know. We had to know this stuff. And this is like my check off flashcards that we needed for our first semester. We had like hand washing, isolation, universal precautions, and like I said, that I didn't use a folder. I used flashcards, and as well as I used a notebook to keep up with all of my checkoffs and things that I had to know, because we was checked off on these in lab as well as in the hospital, in the clinical setting with a patient. So it was a bit intense because you had to know this stuff, and if you had like 15 minutes. If you went over 15 minutes, you was like, you have 15 minutes to do a lot of stuff. So 15 minutes was the time frame allotted for our checkoffs. And I'll show you guys one of these. Like, it kept up, like, say like when you got there to clinical that morning, you would sign in with your name and push what actual facility that you were at that day. So this is from a system called Trajexis, and this one right here is for isolation. So you know that you have your droplet, you have your contact, indirect and direct, as well as you have your airborne. And now, being that COVID is out, we also have that as well, but that will be your same thing as airborne and droplet. And we just had to break down each one of these. And we had to know all of these things. Oh. And we were tested on this, and we were checked off on these. And like I said, we had hand washing, we had the oxygen cylinders, we had isolation. We had to calculate the duration of tanks, like liquid oxygen. We had to know a lot of stuff. So it was a lot of information being thrown at us, and you just had to pick it up. But my professors at Central Virginia Community College are awesome. It was countless times that I had asked them to stay over and help me because it was a lot of information, y'all, and sometimes it was just not going in my head. Like, I'm just being honest with y'all. Like, some of the stuff was just like in class right over my head, and I was like, so my professors, they stayed with me after class, worked with me until I got it in my head, as well as they work with me on the ventilator as well, because some of that stuff on that ventilator, girl, bye. Honey, bye. Let me tell you, the ventilator that we had in class was the same exact ventilator that we had working with in the clinical setting at the hospital. So it's a lot. You need to know your air to oxygen ratios as well. And we had like intubation, extubation, intubation assist with, no, it was physician assist. I'm sorry, physician's assist. We had intubation, extubation, like PEP therapy, mucus clearance adjuncts. Like, we had a lot of stuff. We had vent monitoring, but that was not our first semester. Vent monitoring didn't come until later. But this is what I used to house all of my clinical stuff, as well as we had an app called Trajexis on our phone. And say, like, if we did that specific skill, we had in-center spirometry, hand washing, isolation, but we had like specific ones that was mandatory for each semester throughout our program. Say, like, on the Trajexis app, we ordered that through our bookstore, and it kept up with everything that you did. Say, like, if you went and did in-center spirometry, or if you went and instructed in-center spirometry with a patient, like, you would check like in-center spirometry on there, and it kept up with how many times that you did it. So if your school does not have that, they may need to implement that, because it is an awesome tool, and it helps you keep track of what you have done and if you are adequate in that skill. Because the more you do it, it's like muscle memory. It's like second nature to you. Breathing treatments, we did that. Nebulizers, all of that in our first semester. We learned drugs and stuff in our second semester. So nebulizers and drugs came in the second semester, but we learned a lot of stuff in our first semester. Our second semester was postural drainage and all of that crazy stuff. I was like, oh my God. But this right here, this radiography, that went back to the first semester as well. For these flashcards, like, I went ham on these. Like, I went totally in depth with these because I am, like I said, a visual learner. This is how I made those flashcards from the actual PowerPoint that we had in class. So this right here tells you the structures of the airway. And you have this specific views. You got a lateral view. You got a lateral decubitus view. So your lateral decubitus is for like your pleural effusions, because if you got fluid in there, if you lay them on their side, like, the fluid is going to level out, like, and you'll see it. Like, that's how I did a lot of my flashcards, y'all. Your COPD, you're going to have hyperlucent lungs. You're going to have an elongated heart. You're going to have increased AP diameter. Like, and you going to... Y'all, I bet y'all like, what in the world is she talking about? But I promise, when you get in your program, it's going to be like this. And you're going to know it. And you're going to be able to regurgitate it like I just did to you all. But I hope that you all enjoyed this video. I hope that you all gained from this video. And I hope that this was what you were requesting, as well as far as a look back on my first and second semester of RT school. But my second semester, I will do that in another video, because I don't want this video to be too long for you guys, and I want you all to get in the process of hearing me talk about these look backs. But anyway, let me stop. I'm rambling, y'all. Thank you so much for watching this video. I hope that you all gain from this video and everything. And I hope that you all subscribe to my channel and hit that notification bell down below so that you never miss another upload from me.